change here in Vermont. So thank you for coming to the session today. I'm going to start with a story about the Vermont Early Childhood Alliance, because I think it's a very telling one for the work that we all are doing. In 2000, a bill called Kids Are Priority 1 was introduced into the Vermont legislature and swiftly died because it did not have the political support to invest in Vermont's early childhood system. And when advocates got together with policymakers after the session to get some feedback on why there was so little support for what seemed to be such an important cause, they were told that legislators felt that many advocates who were very passionate about their cause and their work were coming to them for various programs and services, pots of money, but that they were very siloed, that they were very uncoordinated. And legislators empathized with their needs and their cases, however, didn't feel like there was a common agenda among the early childhood community, in one that was powerful enough that they could take up the cause and work with their colleagues in the legislature to make some significant investments in the system. And so that was a real wake-up call for so many people who felt that there were so many needs and the time was now and we needed this to happen. But understanding that public policy change is a long-term endeavor. The nature of the work is very incremental. They were wise and took some time to go back to their communities and start to build some coalitions and some common agendas among many stakeholders in order to come back to policymakers as requested and be a stronger voice and to be a solid block for the needs in their communities. And so 15 years later, we are in a continuous process of doing this, but the Vermont Early Childhood Alliance is Vermont's statewide coalition that really works to bring together various stakeholders within early childhood and in aligned sectors around common priority setting, and works primarily in the legislature to ensure that our bills and budgets reflect our values. The Alliance is a small staff, but we have a large coalition which sets our policy agenda, and then most of the work is in supporting the advocates in the field, those that are working directly with families and with programs to support their skill development so they can be effective communicators on the data and the stories that they see. And most critically, they can plug into the policy process at key times in the decision making. And this is a key point I want to talk about today because there are a lot of opportunities for advocacy, and there are many different cycles of when it's most important and when it's a futile effort just because of timing. And so the more that you can understand the process, you can understand when and how to plug in effectively and therefore advance your cause. So, as I described, our coalition works to really support you in your voice, and a lot of that builds on what the keynote speaker and others have talked about today, in that you have a role to play as professionals, but also in supporting those that you work with in being effective communicators. So today, within the hour, or less than an hour at this point, I'm going to try to review some of the legislative issues that have been the focus of statewide deliberation this session. Not in detail, but I'll just skim over some of the key ones so you can get a flavor for some of those policy conversations if you haven't been plugging in, understandably given all the demands and the busy schedules of your jobs and your personal lives. I'd like to give a little snapshot of the Vermont legislative process and some of the context for the legislators' work. I think understanding their environment helps to get at what I described in terms of being able to effectively weigh in at the right time and speak in a language that they can hear. I'm also going to talk about some key effective techniques that you can use, some approaches to build relationships, to build coalitions, and also to frame your elevator speech and your case. So if you have 90 seconds with a legislator in the line at the grocery store and they're open to hearing what you have to say, you feel prepared and succinct and powerful in sharing your message. And then finally, just a few ideas about how we might work together over the coming year. As I said, this policy work and organizing is, the nature of it is long-term, and we always, there's always work to do, and we can always look long-term for ways to collaborate. I want to talk about a little bit about advocacy, even though it's been defined a number of times today, because sometimes people feel like it's something that they've never done. And when I ask people, and will in a minute, to describe some of their advocacy experiences, a lot of times people will say, I haven't had any, yet when we really talk about it, people have been advocates in their community, in their workplace, within their family, within their peer groups, over and over again, and a lot of the principles apply in terms of how you're effective in working with others to identify a problem, be able to communicate that problem, and seek solutions together. Now, advocacy and lobbying are two terms that are batted around, and people tend to shy away from lobbying, and they are distinctive, and it's important to understand your role. And advocacy is what most of you all do, and is a very important role for people who are working in the field and can talk about an issue and share data and stories that are based on real experiences and put a face on policy issues. And lobbying is something that's like a little more of a harder sell, and is mostly left to professionals who go into the State House day after day, and they testify in front of committees, and they talk to legislators in the hallway, and they are usually really doing a soft pressure about a specific bill or budget item. And there's a lot of gray area in between. Many of you may have gone to the State House and testified, and that is purely very effective and a very appropriate advocacy activity. And many lobbyists are just doing general information. So we all have a role to play, and most of what we do is a very safe, comfortable role, and even if it's uncomfortable advocating for something, it should be, because that's our policy democratic process. It is an uncomfortable process. Many people are intimidated by it, but it is a very important part of our democracy. So I'd like to just hear if someone is willing to share if they have had an advocacy experience before, whether it's talking to a legislator before, or talking to a regulator about a problem you have, or even if it's something that's non-legislative or administrative, something in your community or your workplace, and where you identified a problem, you brought the issue to light, and then you were able to negotiate a change with someone who had the decision to, or the power to make a decision. Someone would be willing to share their experience and what was rewarding about it or what was frustrating about it. Yes.
It's not as big as the State House, but in my town we had open burn days, and it never really bothered me. But when my son was born, he had asthma, so it became a very big issue for us, because smoke cannot be contained to a property, especially when you have a third of an acre or less lots. And so my husband and I went to our town, and it took us 2 years actually to get the ruling changed, but we had to get the firefighters or the chief of the fire department involved, and he was for it as well, because he would have to go out and put out unruly fires often. So it was something that was very deep and personal to us. So we kept fighting, even though we kept being told, no, you have to have a lot of signatures. And we're like, we shouldn't have signatures on this. This is kind of a no-brainer for the health of the community. So,
right. Well, that's a great example, and a number of things come up in the time frame. It does take time. It's not something that you can change in one phone call or one meeting. Usually, you built, you identified other stakeholders in the community. The firefighters also had a problem with this policy, and so even though the reasons might be different, there may be many people, non-traditional allies you may not even think of, that also can be. You could join forces with, and then become a better, and then you just made the case not just based on your own experience, which should have been significant enough, but also extended that to your community. It's the story of self and us, that, you know, we may have a problem or see a situation, but likely we're not the only ones. And if you can develop a universality around your issue, then likely you're going to be more compelling in terms of the system change and this policy change that people, you know, at that level. Any other? Yes.
Yes. A few years back, I advocated for the Barton Senior Center at our local town select board meeting for some space to have a garden for the seniors. And they gave us 3,000 square feet of garden space. And the first couple years that we were active with that garden, we were able to harvest over 800 pounds of fresh vegetables for the senior meal site. And then I started having problems with my knees, and I couldn't do the work that I would like to be able to do, you know. So we formed a partnership with the local elementary school, and we have the Sprouts, the young kids, we call them Sprouts, and they took over the garden, and they're using fresh vegetables in their meal program at the school.
Perfect.
And that was just an empty lot that no one was using, and the town let us take it.
That's great. It's an example of good community organizing and identifying multiple beneficiaries, and then just working through a process. I'm sure there was a process to work through to get the authority and the access to that. That's a great example. One more before we move on? Yeah.
So I'm visiting from Maine, and I'm a legislator in Maine, and I also work at our